a healthy weight. There was a very interesting study that came out of California, out of the Kaiser Permanente group, that found that people who were obese were 3.6 times more likely to develop dementia than folks who were not. And what was interesting is that that finding was not only about being obese, but also about where they carried their weight. So these were people who were obese and carried a lot of belly weight. So they had what we call belly fat or visceral fat. What was also interesting about that study is that it wasn't only being obese that mattered, but even folks who were overweight and carried a lot of their weight around their middle were twice as likely to develop dementia than other folks in that study who did not have that weight and also carried their weight distribution differently. Now that's, to me, a really important finding, both because it was a very large study and also because how much you weigh and where you carry your weight is not something people automatically associate with brain health. But it's really important, and probably as important as what you eat. So that's something to keep in mind. The other thing is that a healthy diet can help protect us from developing chronic medical conditions, such as diabetes or obesity, that increase our risk. And finally, and probably for my purposes on this slide, the least important in a way, is to make choices to eat brain-specific foods. Now, why is this the least important? Because I've been doing this a long time, and I've seen lots of foods come and go, lots of fads. Right now, what we see is a lot of data for omega-3 fatty acids, and we understand from a processing point of view why they matter in terms of the kind of neuroprotective qualities that they may have. So we see people wanting to take omega-3 fatty acids. Some folks are taking it already for cardiac reasons. People are starting to look at it for brain health. The other thing is people talk a lot about eating antioxidants or taking antioxidant supplements because antioxidants are thought to perhaps slow the aging process and reduce our risk for disease. It might be that these things will go out of style in another 5 years. However, what I can say to you is that making choices when it comes to your diet to have foods, for example, that are high in omega-3 fatty acids are probably going to be a better choice for you than another protein source. So if you got to choose between the salmon and the steak, choosing the salmon is better for your overall health anyway. So it's still a better choice to make, regardless of the findings on omega-3 fatty acids, of which salmon is a very good source. And the same is true for the antioxidants. Eating a lot of fruits and vegetables are still going to be better for you than those Fritos, no matter which way you cut it. I can promise you there will never be a study on brain health saying that potato chips and corn chips are good for your brain health. So what do we need to do? Well, if eating smart is something you need to work on, then look to start eating a healthy, well-balanced diet. Balance your intake of things like alcohol and caffeine. Now, notice I say balance. I don't say avoid. Okay? Why? Because they have different relationships with memory and brain health. Caffeine, for example, is a stimulant. How many of you drink coffee? How many of you drink tea? How many of you drink green tea? That has caffeine. I often hear people tell me that it's herbal. It's not. It has caffeine. How many of you drink caffeinated sodas like Coke, Diet Coke, Pepsi, Mountain Dew, Red Bull? Okay? I get everyone with this one. How many of you eat chocolate? I had the pleasure of going to your chocolate store here in South Bend today. That was a treat. So these are foods that all have caffeine, but they're not necessarily bad for you, right? It's a matter of how we balance caffeine in our life. Caffeine is a stimulant. It can help us feel more alert and be more able to learn new information because it increases our concentration. What happens is that too much caffeine becomes overstimulating and can make it harder for us to concentrate and learn, therefore making it more difficult for us to retain information. Also, as we grow older, our body doesn't clear caffeine or alcohol as readily. Our organs are just not as efficient. So that we need to reduce our intake because they kind of sit around in our system for longer. And sometimes we self-adjust. So there probably, if you thought about it, for some of you in the audience who are older, you might have already started to drink less caffeine, right? Because you realize it affects you differently than it did when you were in your 20s. Or you may feel you don't need it as much as you did when you were in your 20s. So balancing alcohol and caffeine is important. Maintain a healthy weight. That's really critical. And as importantly, avoid carrying your weight around your middle. Follow a specific diet if you have an underlying medical condition. And then try adding foods that are high in omega-3 fatty acids and antioxidants. Why? Because they can't hurt and they represent better choices than some of the other things that we have available to us. Does people know what this is? Anybody? This is a BMI chart. This is how you track your body mass index. And I realize that might be hard for you to find yourself on here, but this is something that's readily available, and you can find it on the internet, and there might be other sources from the hospital where you can find this. And what this shows you is where you fall in terms of your weight and your height, okay? 3, take good care of yourself. Now, that was the slogan for my hospital, for Mount Sinai Medical Center, for many years, so it was a good place to put it in. Why should you take care of yourself? Medical care is key to addressing issues that can make it harder for you to remember day to day. Let's just take one example, hearing loss. There was an article several years ago that suggested that close to 70% of adults over 75 who were prescribed a hearing aid did not use one. Now, that is astounding, because if you can't hear information and you're worried about your memory, chances are part of what is getting in your way is your ability to learn the information to begin with. And in that case, it's not a forgetting problem, it's a getting problem. You're not getting that information. Now, I recognize that there are obstacles to using a hearing aid. People find them uncomfortable. They find them socially awkward. And they can be expensive. But that's just one example of different things that get in our way day to day that may make it harder for us to remember. If we have a cold or the flu, we can't expect ourselves to remember as well as on days that we're well. So that's not something we can avoid, but it's something where we can give ourselves a little grace, if you will, in the expectation that we have on our memory, or use other methods to support our memory. We know that certain ongoing medical conditions can increase our risk for developing a serious memory disorder. Again, I keep mentioning, the big 3, obesity, diabetes, and hypertension. So that's something that we need to know and that we need to manage. And finally, certain medications may unintentionally make it harder for us to remember. The example I always use here, and let me also say that when I talk about this, I don't mean that you should rush home and stop a medication. If you're prescribed a medication, it's for a reason, and you should only stop a medication that you've been prescribed in collaboration with the physician that is treating you. But one example that I like to use here is for bladder control medications. There's a family of bladder control medications that we know from research causes short-term memory loss, because the neurotransmitter system, the mechanism by which that medication works, is a neurotransmitter system responsible for memory. And that family of medicines used to be used as antidepressants, and we know that they caused temporary, but nonetheless caused memory loss in older adults. So there's certain things that we need to be aware of in terms of taking care of ourselves day to day, and we need to be responsible for monitoring and watching out for ourselves in that regard. So what is the action plan here? Number 1, get regular checkups. Okay? Make sure that you keep up on your medical care. Stay healthy. Do what you can to stay healthy. Manage your medical conditions. It sounds so simple and easy when we say it here, but I've seen plenty of people who've skipped visits, who go off their hypertension medication and somehow don't follow up, and who end up in crisis, right? So it's something that we need to watch out for, and we need to be responsible for working with our doctors and working with our other health care providers to manage our medications. Let me close up this little section here by pointing to a study that I think is pretty interesting. The Harvard School of Public Health published a